Assalamu alaikum wa rahmatullahi wa barakatuh. This is, inshallah, will be our last lecture in this course. Issues in community pharmacy. We will discuss issues in community pharmacy. We'll try to focus those related on those related to pharmaceutical technology discipline. The points we will discuss in this lecture, and you are supposed to understand and be able to recognize by the end of the lecture, are about what is community pharmacy, receiving prescriptions, how to interpret the prescription, how to understand or what are the different abbreviations used and what is their meaning. We'll talk about the role of community pharmacist. What are the different functions he's supposed to do, including extemporaneous preparations. We will discuss later about extemporaneous preparations as well, and about patient counseling also. Okay. So first, what is community pharmacy? As you know, community pharmacy is not affiliated to any institution. It is also called retail pharmacy. So it is a kind of retail business dealing in medicines and healthcare products. And this is the most common type of pharmacy practice settings usually. And here, pharmacists provide direct patient care services in a community or retail setting. So the pharmacy is situated in certain community, in certain area. It is a shop and a kind of retail business, as we mentioned, and it is usually serving this community or neighborhood, easily accessible to the public. You don't need any subscription, you don't need any condition to access. As long as it is during opening hours, you can access the pharmacy, and you can request service from the pharmacist. Okay. So in this community pharmacy, what is the role of the community pharmacist? Usually several functions he can do. Not only these, but additional to this also he can do some functions related to business, like he's also a manager of the pharmacy, he's ordering medications, he's doing financial planning, if he has workers with them, so he has human resources management and so on. But when it comes especially to the medicine, so the role of community pharmacist is medication dispensing, patient counseling, medication therapy management, over-the-counter products recommendation and sale, health promotion and disease prevention, collaborative care, and extemporaneous compounding. So medication dispensing, they receive prescriptions from healthcare providers, from doctors, and dispense the medications to the patients according to the directions by the physician. They, of course, have to review the prescription, ensure that they don't have any drug-related problems. And in case there is any drug-related problem, they have to contact the physician. Dispensing the medications to the patient will also include patient counseling. We have to advise or give the required information or counseling and education to the patient regarding the safe and effective use of medications they are receiving. And we should offer guidance on the dosage, administration, potential side effects, drug interactions, and precautions to be taken. Also, medication therapy management is one of the functions provided by community pharmacists and involves comprehensive medication review, assessment of therapeutic outcomes of the medications the patient is currently receiving, especially for those having chronic diseases and on long-term therapy. And they should participate in development of personalized medication management plans for patients with chronic conditions, okay? For those patients with chronic conditions. So for this personalized medication management plans, and if there is any requirement for modification of doses, of dosage regimen, of medication plans in general, there should be some collaboration with other healthcare professionals. So they collaborate with other healthcare professionals, including physicians, nurses, and allied healthcare providers to ensure optimal patient care. Communicate medication-related information, offer recommendations, and participate in medication therapy management team. So this medication therapy management is done in collaboration with the healthcare provider. The pharmacist cannot take the decision to change the medicine on his own, but he has to consult with the physician and get approval. Okay. They also assist patients in selecting suitable OTC medications for minor ailments such as cough, cold, allergies, pain relief, and they provide guidance on the proper usage, potential interactions, and self-care recommendations as well. And as we know, these OTC products, as we mentioned, they are non-prescription medications. They are sold without prescription. So the pharmacist can advise the patient on the proper medication that he can take for minor ailments. Usually they are used for minor diseases, and they can advise them on and select for them the appropriate medication and advise them how to use. And they can give them also other advices related to the management of their condition. Simple conditions like runny nose, skin allergy, for example, diarrhea, constipation, and so on. Okay. They also conduct healthcare screening. So you can approach the pharmacy, you can check your blood pressure, you can check your the blood sugar level. There are also some tests for lipids. There are tests nowadays also can be sold in the pharmacy for COVID, for example. They can participate in some immunizations. They have the license in other countries to give, for example, flu vaccine. Okay, and they can participate in wellness programs to promote public health, like weight reduction and so on. They provide guidance on lifestyle modifications, smoking cessation service as well, weight management, and preventive measures for many diseases. Extemporaneous compounding is that they will make preparations or medicine preparations on demand based on individual patient prescriptions. It's not the small scale or large scale production will be available for sale. No, it is based on individual patient prescriptions. And it should involve accurately measuring and combining ingredients following established compounding procedures and guidelines. So in addition to these functions, as you mentioned, there are other functions like human resource management, financial planning, medication ordering, stock management, and so on. These are administrative functions. Okay, so what is prescription? Usually the pharmacist for prescription drugs, he should dispense them based on prescriptions from a licensed healthcare provider. So what is prescription? Prescription is a handwritten, typed, or computer-generated form, which serves as a means of communication between the prescriber and the pharmacist. So this is the way they communicate. The physician will send a paper. Nowadays can be electronic form called prescription. Contains the instructions of the physician regarding what medications to be given to the patient and how they should be used. Details of the medicines to be dispensed for a named patient, and it is issued by an authorized prescriber. Physician, the prescription may contain one or more items, medicines, can be medical appliances, and write, for example, watches, for example, or rest support, okay, are medical appliances. Can have also nutritional supplements. And as we mentioned, it may be paper or electronic form. So after your graduation, inshallah, maybe you can work in one hospital that is called paperless hospital, where they don't use any written forms, but all on the system. They have hospital management system, and there you can find electronic patient files. You can receive the electronic prescriptions and dispense based on that. Okay. What information should be included in on a prescription? There are mainly three categories. To whom medicine should be given. It's about to whom, what, and by whom. Okay, so to a patient, so details about the patient, and what to give to the patient's medications, details about the medications, the name, the dosage form, for how long to be used, instructions for use, and who did prescribe, who is the prescriber. So it should have the name, address, telephone number, qualification, signature, and stamp of the healthcare provider, the physician, for example. In some countries, some nursing staff may have limited prescribing authorization. So healthcare provider, not always physician. It can be a nurse, depends, midwife, but they will prescribe based on a limited list. They cannot prescribe anything. Okay? Medication details will include name, strength, dosage form, dosage and dosing regimen, total amount to be dispensed, and directions for use, how to be used. Okay, take it after food, before food, instill as drops in the eye, in the ear, whatever, swallow, PO, okay, and so on. Details about the patient, usually name, address, date of prescription, and usually should include the diagnosis. What is the disease? This should be the layout of the prescription. Usually the top should be, and in some prescriptions, the bottom, there will be the details about the clinic, the doctor name, and the address of the place where he practices, hospital or clinic or whatever. Usually we'll have details of the patient, followed by including diagnosis, followed by details about the medicine, with the sign RX, means receive. Each medicine, it will be written, the medicine dosage form and so on, and instructions how to use. Actually, this preparation doesn't contain 3 medicines. It contains a preparation with 3 ingredients. Okay, but if 3 different medicines, then after each one there will be the instructions for use, and will be ended by the signature of the physician and stamp. And some countries require that the stamp will contain the number of the license, for example, for practice of the physician. They may have details about refill, how many times this prescription can be refilled. Means that you dispense for him, for example, for chronic diseases, 1 month therapy, but he can come for you up till 6 months, means allow 5 refills. Then without going to the physician to get a new prescription. But by the end of the 6 months, he should visit the physician again, follow up, and check his disease with the physician, and then he may get a new prescription after this. Okay? In order to be able to dispense medications, you should be able to understand, you should be familiar with the abbreviations used in prescriptions. There are a lot of abbreviations are used. You should be able to understand, to know them, to interpret them. There are some abbreviations regarding to the administration time with regards to meals. Before meal, after meal. If AC is anti-sebum, PC is post-sebum. This is Latin, actually, from Latin words. The meaning is before meals and after meals. You should be familiar with the abbreviations related to the route of administration. If mentioned that PO means per os or by mouth, GTT is drop, AU is in both ears, PR is per rectum, means into the rectum, PV into the vagina, SL is sublingual, means under the tongue, ID is intradermal, means into the layers of the skin. There are abbreviations related to the administration frequency, how many times to take the medication a day. If QD means once a day, BID means twice a day, TID is 3 times a day, QID is 4 times a day. If we write QAM means every morning, QPM is every evening, QHS is at bedtime, PRN as needed. For example, medications for pain. Once the patient have pain, he should take one dose. This is as needed. Okay. Q, and then you put any number, and then hour means every that number of hours. So if you put Q 2 hour, 2H means every 2 hours. Q6H means every 6 hours. Q12H means every 12 hours, and so on. QOD is every other day. QOD is every other day. IM, intramuscular, IV, intravenous, in the vein, in the muscle. Intramuscular is in the muscle, intravenous is in the vein. Subcutaneous, or written as SC or SQ, means under the skin. Subcutaneous means under the skin. Top is abbreviation for topical, means to apply on the skin. Ophtha means ophthalmic or into the eye. Otic means in the ear. Inhale is for inhalation, to inhale. And buccal means between the cheek and the gum. Okay? These are most of the abbreviations that you will hear or you will see in your practice. Writing prescriptions. When it comes to writing prescriptions for the drug name, it should be generic name or branded name. So it depends on the regulations. Some countries, they request that it must be in generic name. Some countries, they allow both. So it depends on where do you practice. What is the difference between generic and brand name? For example, the name of the drug is, the active ingredient name is paracetamol. This is a generic name. Company may produce tablets containing paracetamol and call it Panadol, for example. So Panadol is the brand name, or we call it proprietary name. Okay. So you can receive a prescription where the physician will write paracetamol 500 mg tablets, 2 tablets every 6 hours, for example. And the physician may write also Panadol or any other name, any other brand name by any other manufacturer, 500 mg tablets, 2 tablets every 6 hours. Okay. Strength of medication should be written usually in metric units, not apothecary. Sorry, this is 2 words, not apothecary. Okay. So we use usually milligrams. Don't use grain, ounce, and so on. So we usually use, for example, 60 milligram, gram, so on, ml. Okay. Still, you can use tablespoonful and teaspoonful. You should know about them. If tablespoonful, then it is 15 ml. If teaspoonful means it is 5 ml. Okay. There are some specific regulations when it comes to prescription of psychotropic substances. Psychotropic substances like morphine, like benzodiazepines, the drugs that affect the mood and consciousness. The problem for these drugs is addiction liability. So there are some restrictions to prevent addiction or to counter, to not allow abuse of these medications, which may lead into addiction at the end. Okay. So we call them, some countries, many countries, they call them narcotic and controlled drugs. In Malaysia, the most common term used is psychotropic substances, and they should be prescribed by authorized healthcare professional, including medical doctors, dentists, and veterinary surgeons. These professionals must hold a practicing certificate and be registered with the relevant regulatory bodies. They should be written on a specific prescription form. Okay, you cannot get it on a normal prescription, but should be a specific form. We call it Form F for psychotropic substances. And it should not be typed, but should be written by hand, and in ink, means cannot be erased, cannot be changed. If it is in ink, then you cannot change it, right? So then should have complete details about prescriber name, address, and contact details, about patient name, address, and ID number, date of prescription, drug name, strength, dosage form, and quantity prescribed, directions for use, including dosage instructions, and duration of treatment, and prescriber's signature and professional registration number. Okay? There must be a signature of the prescriber. Okay? We have 5 schedules for these drugs, depending on addiction liability. So the highest potential for addiction and abuse is Schedule 1. High potential for abuse is Schedule 2. Potential for abuse is less than 1 and 2 is Schedule 3. The more you go down, Schedule 4 has less potential for abuse, and Schedule 5 is the lowest potential for abuse. Okay? Schedule 1, these usually materials that have no accepted medical use and are strictly controlled. So these substances cannot be prescribed as medicines. Schedule 2 contain the opioids and amphetamines, morphine, methadone. Opioids except codeine, okay? They have recognized medical uses under strict control. These are tightly regulated and prescriptions for them are closely monitored. Okay? The more you go down, Schedule 3 will have codeine. Codeine have less addiction liability compared to morphine, bethadine, fentanyl, and the other members of the family. It contains ketamine also, used in anesthesia, and containing benzodiazepines. Schedule 4 have tramadol and certain sedative hypnotics that are less hypnotic compared to benzodiazepines, like phenobarbital and chloral hydrate. The Schedule 5 is the last thing, which contains cough syrups containing codeine in low concentrations. Codeine in low concentrations. So what are the differences between them when it comes to the prescriptions? Mainly is the validity period. So Schedule 2 and 3 valid for 30 days. Schedule 1 is not here because it will not be prescribed. And Schedule 4 and 5, Schedule 4 will be valid for 90 days. Okay. When it comes to the refill, also the other difference is you cannot refill more than 5 times in 6 months period for Schedule 3 to 5, but no refilling for Schedule 1 and 2. No refilling for Schedule 2. We don't talk about Schedule 1. Okay. Usually this should be registered in a book and then should be kept also for appropriate period of time and should be dispensed by authorized pharmacists. Okay? To verify the prescription and should record it in a specific registry. Another topic we talk about, or another issue we talk about in community pharmacies, is dispensing errors. Dispensing errors are there. They are not common, but they're there. Medication errors in general containing so many things. There will be prescribing errors, can be dispensing errors, can be also errors in the use of the medication by the patient. So the part that is related to the pharmacist we talk about here is dispensing errors. There is about 1.7% of the dispensed medication is dispensed in error. There are about 4 errors per day per 250 prescriptions filled, over 51 million dispensing errors per year. The most relevant types of these dispensing errors are dispensing incorrect medication, dosage strength or dosage form. So incorrect medication, incorrect dosage strength or incorrect dosage form. There may be some dosage miscalculations or failure to identify drug interactions or contraindications. These errors have different types, commission versus, there are commission and omission errors, mistake and slip errors, potential and actual errors. Okay? So first, what is error of omission? What is error of commission? Error of omission is failure to counsel the patient, failure to screen for interactions and contraindications. So it means that we forgot to do something that we are supposed to do. This is the omission. Something we didn't do. We are supposed to do. We omitted it from the list of tasks that we are doing. But errors of commission is we do something wrong. Miscalculation of a dose, dispensing the incorrect medication or incorrect dosage or incorrect dosage form. Errors may be also mistakes or slips. Mistake is doing things intentionally, but actions are incorrect because of knowledge or judgment deficit. So we do something, we know that we are doing this, but it is wrong because of our lack of knowledge. So, for example, dose prescribed that exceeds maximum safe limit. Okay, so we prescribe large dose, it is unsafe, but exceeding the maximum safe limit, but we do it intentionally, but we don't, because of lack of knowledge about the dosage range for this medication, for example. And once this is done, usually the behavior of the prescriber or the pharmacist is in problem-solving mode. They are aware, they have attention. But slips, they happen when the patient, the prescriber or pharmacist is unconscious about this. They do things unintentionally incorrect because of attention deficit. Here, the behavior is in automatic mode. They work automatically, and they didn't think about what they're doing. So they do something wrong in this case. Like, for example, dispensing chlorpromazine when the prescription was clearly written, for example, as chlorpropamide. So they just read chlor and they got confused. The mind received it as chlorpromazine instead of chlorpropamide, and they dispensed it and they didn't notice. Okay, the common causes for dispensing errors that cause it is work environment itself. Okay, this will cause attention deficit errors, especially like the workload, distractions, and work area is unorganized, crowded, noisy, and so on. When it comes especially to those mistake errors, so use of outdated or incorrect references. How to prevent medication errors? Should maintain and clear and accurate patient profiles. So this in countries where there are patient profiles that can be accessed by the pharmacist, then having a clear and accurate patient profile, having related information or relevant information such as allergies, medications used currently by the patient, the medical conditions he's suffering. It can help us also to screen any prescription and see if there is any interaction with the current medications, if there are any allergies from the medication currently we just received in the prescription. And we can see also if there is any interaction between the medical conditions the patient having and the new prescription. Okay. We should also thoroughly review prescriptions that we receive for accuracy and appropriateness. We check for the legibility, that all the handwriting is clear, so that we don't dispense look-alike drugs. We should check for if there is any missing information that can affect also giving instructions to the patient about the way to use the medication. Potential drug interactions, we check correctness of medicine's dosage regimen, whether this regimen is suitable for the patient age, the patient diagnosis, and comorbidities. If I give you example here about diagnosis, for example, you can receive an antibiotic for different conditions, that those will be different. Like, for example, using an antibiotic for pneumonia may be different from mild infection, may be different from, you need higher doses in conditions like otitis media and much higher doses in CNS infections. Okay, so we should double check and see whether this dose is suitable for the condition. And we look for comorbidities. Maybe the patient have some diseases that may be affected by this medication, so we should not give them large doses. For example, patient is hypertensive and you are prescribing a dose of a decongestant which has a vasoconstrictor effect, so we should not give large doses. We should look for problems like medicine duplication, means two medications having the same effect, polypharmacy, so many medicines, inappropriate drug therapy not suitable for this condition, contraindications, allergies, usual usage and suspected drug misuse or abuse. Maybe this medication is repeatedly prescribed for the patient and in large quantities, and this medication is abuse medication. And any conflicting instructions in the preparation, in the prescription. Okay. We double check also the dispensed medications. So usually better that medication will be collected and prepared by one person and then double checked by another to prevent dispensing errors. Take the time to counsel patients regarding their medications, including proper use, potential side effects, and any necessary precautions. Can also utilize technology and automation. It can help using electronic prescribing systems and automated dispensing machines. Electronic prescribing systems themselves also they have built-in tasks. They can, or built-in functions, they can screen for drug-drug interactions, drug-disease interactions, inappropriate doses, and other drug-related problems. So they give notification to the pharmacist that there is a drug-related problem here. You enter a different dose, for example, then it will give you notification and so on, and can be used for printing the label. So the label will have exactly the information that are in the prescription. There will be no change. Can use also automated dispensing machines. When you dispense, you should ensure the 5 rights: that we have the right medication, given in the right dose, right route of administration, and right time of administration to the right patient. You have to ensure that all these are right. In some crowded pharmacies, especially hospital pharmacies, you may receive many prescriptions, patients are waiting, and then you have a technician that is preparing medicine for you, and then you have to call for the patient to give the medication. In this case, you have to call the patient, he will come. You have to verify also that he's the right patient. Sometimes in the noise, crowdedness, they may wrongly hear the name as their name and they come to collect. It all happened with us during practice. So as a preventive measurement, you should verify again that he is the patient with the name that you called. Okay? Dispensing processes usually will include number 1, processing, number 2, preparing medicines, counter checking, recording, and issuing medicine to the patient. So once you receive the prescription, you have to screen the prescription. And screen means you look for the prescription is complete. All the information required are there. Sometimes you need to have, for example, a signature or stamp of the physician. If it is not there, then you have to reject it, for example. Okay? So this is the screening. You look for completeness of information. Interpreting the prescription, you have to look for the things we mentioned, that no drug-related problems. Okay? So you have to read, understand all the instructions written, the names of the drugs, and you look for any drug-related problems. So what to do if you have any drug-related problem or unavailable medication, drug shortage, and so on? Then you have to do clarification. You call for the physician and you mention about the problem, and you can, if you have suggestion for the solution of the problem, you suggest, and then you get the approval for the physician regarding this change. Okay? And if you have shortage, for example, stock out situation, what to do? You have another alternative. You can call the physician, you recommend the alternative, for example, or what to do. Then once these problems are solved, then you can start to prepare the medication. Filling means that you collect the required amount of the medication. Labeling is to fix the label, showing the instructions, how to use. And you check that all this is correct, and better to be verified by another person in the pharmacy, counter checking or double checking. After this, if you need to record, like here in Malaysia, you need to record the medicines prescribed prescription medicines. Then you prescribe them, you record them, and then you issue the medicine to the patient, and you counsel the patient on the proper use of the medication. Okay. When it comes to labeling, then we should have same like the prescription, but it is for individual medicine. So your prescription may have 3 medicines, then you have to generate 3 different labels, 1 label for each medicine. So it contains the same thing also, information about the prescriber, information about the patient, and information about the medication. Okay, so you may have prescription number when it comes to the prescription itself, doctor that prescribed the medication. These are about the prescriber. When it comes to the patient, there should be the name of the patient, and here also you can see the name of the hospital or clinic. Okay, then you have prescription number, you may have name of the patient, and information about the medication, how to take the medication. For example, here, take 1 capsule by mouth daily as needed for constipation. Take medication with 8 ounce of glass or water, with 8 ounce glass of water. Discard after this date, this expiry date of medication. There's information about the refill and how many are included in the package here, how many has been dispensed. Okay, and here the number of refills, maybe here allowed up till 10 refills. If he come again for refill, then you print a new label, and it is mentioned here what is the refill number. Okay. In the pharmacy also, another issue we talk about is pharmacy merchandising, which means how you are going to arrange the medications in the pharmacy. There are different systems. You may arrange your medications in the pharmacy. Merchandising means the arrangement of medications in the shop. Okay, so can follow ATC classification system, means anatomical therapeutic classification system. So you can, for example, arrange GIT drugs together, respiratory drugs together, antibiotics together, cosmetics together, and so on. Or you can arrange based on the dosage form, means you put the tablets together, capsules together, syrups together, injections together, and so on, inhalers together, and so on. Or you can arrange them alphabetically, means you follow the name. Okay, A drugs first, drugs with B, the name start with B next, and then C, D, and so on. You can arrange them also based on speed of movement. So fast moving issue items, you put them near to the counter. Then the intermediate one, or normal movement, is just arranged in the pharmacy in the regular place. And the slow moving items can be distant site. The far one, the most distant site in the pharmacy, is for slow moving. This can help you. You don't need to move too much. So for the fast moving, they are near to the counter. You can pick them all the time while standing near to the counter. And then those that are seldomly requested can be far. So rarely you need to walk long distance to collect the medication. Okay. But in reality, we don't follow one system. We follow usually a combination of all the above. How? If you work in any pharmacy, usually fast-moving items, irrespective of the dosage form, the whatever, or the name, they will be placed near to the counter. Usually, some items will be placed based on the ATC system, anatomical therapeutic classification systems. So usually antibiotics are separately arranged. Controlled drugs, cosmetics, and nutritional supplements will be in separate sections. And also surgical appliances, they will be in separate sections. But when it comes to the rest of medications, usually they will be classified or arranged based on the dosage form. Usually oral dosage forms, the solid oral dosage forms together. Injections will be together. Eye drops will be together. Eye and ear drops. Syrups usually will be together, and usually will be placed near to the floor. Okay, in the lower part of the cabinet will be syrup. The upper part will have the solid dosage form. Okay. Also place related departments next or near to each other. For example, cosmetics, hair care products, health and beauty aids, usually located near to toiletries and feminine hygiene products, because consumers who come to a pharmacy to purchase the former products also tend to need the later ones. They come to buy cosmetics, hair products, and other feminine hygiene products and toiletries all together. Okay? When it comes to patient counseling, then we need effective counseling so that we are sure that we give the necessary information and they are received by the patient presenting to the pharmacy. Okay? The counseling should include the following information: how and when to take or use a medicine, how much to take or use, how long to continue treatment, what to do if a dose is missed, how to recognize side effects and minimize their occurrence, lifestyle and dietary changes, drug or drug nutrient interactions. Okay, so for example, you have tetracycline you prescribe to the patient. So tetracycline is an antibiotic. You should tell the patient, for example, how many capsules will be taken and how many times per day and for how long. For example, prescribed for 5 days or 1 week, then you have to ensure that you tell the patient for how long, that you have to continue the treatment up till the end of the course, even the symptoms improved. Okay, for example, you have infection with fever. Usually fever will subside within 2 days. Maybe after this you say, okay, no need to, now I'm healed, cured, and no need for the antibiotic. You have to inform them that they have to complete the course. What to do if a dose is missed? Then you have to advise them. If you missed a dose, then you have to take it as soon as you remember, but if it is near to the next dose, then you don't need to take it. How to recognize side effects and minimize their occurrence. Probably for tetracycline, no much side effects to mention. There are side effects like dizziness, whatever. For other medications, you have to inform about them, drowsiness, and so on. Lifestyle and dietary changes, for example, insulin. If you are prescribing insulin to the patient, then you have to educate them about the hypoglycemia signs and symptoms, how to identify it, and how to check also self-monitoring of glucose, and then what to do if he has hypoglycemia, for example, taking sweets with simple sugars in order to correct the hypoglycemia. Lifestyle and dietary changes. This is more with chronic diseases, patients with hyperlipidemia. So to advise them about dietary changes, how to reduce the fat intake in the food. Patients on hypertension, so how to reduce the salt, for example, about salt in food and should reduce and how. And alternatives like potassium chloride instead of sodium chloride can be used. And then you can talk to them about drug interactions, drug nutrient interactions. For example, in tetracycline example, there's interaction with calcium, magnesium. So you advise them about the concomitant use with antacids, for example, with milk products and so on, that they have to be separated at least by 2 hours. Okay. We have example here on also you have to guide to, especially when there is device like inhalers and so on, then you have to teach them how to use. So here are examples. They're not including all the dosage forms, but for example, for instilling eardrops, you have to teach them about how to instill the eardrop. For example, here in adults and children, there is difference in the way to administer. You want to instill one drop, you want to be sure that it will go through the ear canal. Usually you pull down the ear penny in case of children, but you pull the ear up in case of adults, and then you instill the drops. So you can also get you can use also some what do you call it, some flyers like this that have photos also to guide them. So you teach them how to instill the eardrops. Inhalers also you have to teach them. For example, inhaler here have the drug suspended in carrying gas, liquefied gas, so they have to shake first. They remove the cap, the cover, shake the inhaler, breathe out gently, then actuate, press and inhale at the same time. Hold your breath for about 10 minutes and then you can slowly breathe out after this. This is all to ensure that the drug is deposited in the lung and give adequate effect. Sometimes the problem in the, like here in medications with devices, the problem is not from prescribing problem. The patient, the physician, the pharmacist also explained properly. The patient understand the dosing instructions, but didn't understand how to use the device. So even he's taking the correct dose, but he's not taking it correctly. So there is no effect from the drug. That's why there will be no optimum control of the lung disease. Dry powder inhalers also, you can use also flyers like this. You can show them how to use. Here, of course, we don't have suspension. We just have a dry powder, so no need to shake. But it's about just to open the inhaler, and same will be like the MDI after this. Just exhale, and then breathe deeply through the inhaler. So he will suck like this or inhale the dose, and then hold the breath also for 10 seconds and breath out slowly and close the inhaler. Okay, you can also use flyers like this, how to use rectal suppositories, for example, what is the appropriate method of administration, vaginal suppositories, and so on. Okay, so here, for example, some step that they may not know is about lubrication. So better you the suppository should be lubricated either with water or like KY jelly, for example. This can help to insert the suppository easily without damage to the rectum. Okay. Topical applications for creams and ointments. So about how to take the correct dose, we have here a unit called fingertip unit, FTU. Fingertip unit is that you take a medication amount of product that covers the tip of the caregiver's index finger to the distal skin crease from a standard 5 millimeter tube. This is usually sufficient to rub over an area of the skin equal to double of the adult palm. Okay, so if you take this dose, it is enough to rub over an area equal to 2 adult palms. Okay, so when it comes to children, depends on the age also. Here's the guidance how to this FTU and F2. FTU is equal, for example, if I want to cover to apply to the face and neck, how many FTU I need? Here for 3 to 12 months, 1. For example, for 6 to 10 years, you need 2 FTU. More than 10 years, we need 2.5 FTU. To cover the arm and hand, leg and foot, anterior chest and abdomen, for example, how many do we need? Depends on the age. The higher the age, the more the body surface area, so the more those units you need to use. Okay, last issue we'll discuss in this lecture is about extemporaneous dispensing. What is extemporaneous dispensing, and what is and what are the equipments used, and how to do it? Okay, so extemporaneous dispensing, or sometimes we call it compounding without the word extemporaneous. So compounding or extemporaneous dispensing is the preparation, as we mentioned, of and supply of a single unit of a product intended for immediate use by a specific consumer. It's for individual patient, based on a prescription from a prescriber. Okay, so as we know, largely in the pharmacy will depend on those products manufactured by pharmaceutical industry, and it's not preferred usually to rely heavily on compounding in the pharmacy, but in certain conditions we may need to do compounding. Okay, so nowadays most medicines are manufactured by pharmaceutical industry under well-controlled conditions and packaged in suitable containers designed to maintain the stability of the product. They may be even, for example, sealed in an inert atmosphere like carbon dioxide or nitrogen to prevent oxidation in some cases. So they are safer to use. They are accurate in dose. Everything is better compared to extemporaneous preparation when it comes to hygiene and so on. So because they are produced in GMP certified facilities. Okay, but we need in certain conditions, we need extemporaneous dispensing. Okay, of course, this cannot be, it's not well controlled like in industry, but should be used if the manufactured product is unavailable. Okay, in which conditions manufactured product will not be available? Sometimes there is no licensed product for this active ingredient in this dosage form. Sometimes there is shortage of medications, products no longer on the market or unavailable from the manufacturer. So in case of drug shortage, then we can compound them. Sometimes we need an individualized dose, and for example, for pediatric or geriatric patient, and the medication is not available in such doses in the market, and not in this strength, I mean, and then also we may need some individualized formulation for the patient. For example, usually these individualized formulations will be mostly requested by dermatologists. Okay, they will mix different ingredients, corticosteroid with skin whitening, with probably keratolytic agent, and so on. And we may need sometimes veterinary products. Formulations means here for different species. I have product for human. I need to compound a different strength or different form for veterinary use. Okay. So no licensed products, this one especially for children. Sometimes in some conditions, for example, atrial septic defect, they need, for example, drugs like diuretics. If you look at like Lasix, for example, for Lasix you'll not find syrup, you'll find dosage form like Lasix injection, ampoules, or Lasix tablets. But here we need it for a small child, so we have to make syrup for that child. Okay, so this will be done through extemporaneous compounding. So you have a Malaysian guidelines regarding extemporaneous compounding. You can find on the I think the board of pharmacy board website. They have some guidelines. So here the steps if to prepare or not to prepare extemporaneous drug, preparation or drug. Here you have to identify list of extemporaneous medicines currently being used in the hospital, and then check if this is appropriate. If yes, then what is the registration status? If no registration, no registered medicines, if it's not registered, then get the company manufacturer to register or produce. If registered, then determine its status. If it is not given, then apply to get this status. If yes, then check commercial availability. If not available, then prepare and dispense extemporaneous medicine. But if available, then better to buy. You can check the cost of commercial product versus preparing the medicine. If less costly to buy, then better to buy than to prepare. So if less costly, the commercial available one, then propose hospital to purchase. If more costly, then you can make the medication. Okay. As a pharmacist, your responsibility is to maintain equipment in working order, ensure that the formula and dose are safe and appropriate, ensure that all materials are sourced from recognized pharmaceutical manufacturer. So materials here means the starting materials you use to make the preparation. Whether you are using raw materials, like for example for syrup you are using sucrose, or for example you are using medications and you change the dosage form, as we mentioned about, for example, Lasix, you make from the tablets, you make syrup, then tablet Lasix should be from recognized pharmaceutical manufacturer. You should ensure correct calculations, maintain good records and labeling. Any staff involved in the process should be accurately trained, and you should have written standard operating procedure for all these requirements. You should ensure that the medicine produced is of the highest achievable quality and that the highest standards must be applied during preparation process. Okay. So what are the requirements for compounding? You need a safe system of working. It is essential for dispensing and development and you need also use of SOPs that should be followed. I will show you what are there are some references that contain already SOPs you can use. And you should ensure that dispensing bench, equipment, utensils, and the containers, which is to hold the final product, must be all clean. Dispensing staff should have high standard of hygiene. Hand washing facilities should be readily available. They should use appropriate gowns or clothes that are clean overall should be worn. Hair should be tied back and preferably be covered with a disposable hat or cap. Any skin lesions should be covered with a dressing. Disposable gloves should be worn during the preparative work and discarded afterwards. Consideration should be given to the use of masks if volatile substances or fine powders are to be handled, so that to protect the person who is dispensing or making the preparation, we protect them from the inhalation of this powder. Okay, we will use a variety of equipment. Number one, the weighing equipments like balance. You have different types of balance. You have mechanical beam balance and you have electronic top band balance. Mechanical beam balance is the one that you have to put weights, and this is not commonly used nowadays. Mostly we use electronic top band balance. We have to take care of it. We have to know how to use it. The most important things that we have to notice is, number one, we have to level it up. Usually you have a mark here for the watermark. You have to be sure that watermark in the center, it is horizontal. And then before you weigh, you have to tear it to zero. For example, you weigh in a paper, you put the paper first and then you tear it to zero, and then you can put your material and record the weight. And then you have to keep it clean all the time, the pan of the balance. If you are using the mechanical beam balance, you are putting weights, you don't hold the weights with your hand, but you hold them with tweezer so that you don't introduce dirt and moisture and so on to them, so it will affect the accuracy of weight. Okay. Also, there is a minimum weight for each balance. So using balances in the lab also you have to be careful about this. I saw some students, they weigh 1 milligram on this electronic top band balance in our lab. So this balance is not for weighing 1 milligram. Before you use your balance, you have to check the catalog. You have to check what is the minimum weight. So if you use any weight less than the minimum weight, weighing will not be accurate. Okay. So you have to always read the manufacturer's instructions before using an electronic balance. Okay. These are the most important points. There are equipments for measuring liquids. Usually conical measures can be used, or cylindrical measures also can be used. So here we have to read the meniscus, means the top level of the liquid. You have to make it vertical when you read the level, and then you have to make the level front or opposite to your eye level, just in your eye level. Okay. And then once you pour the liquid from it, you have to thoroughly drain it to deliver all the volume that was inside. Sometimes if you have a viscous fluid, that will have difficulty that once you pour, there will be some more remaining, then you can put excess. For example, you need to take 40 ml, put 50 ml. The difference is 10 ml, so you pour and then till you leave 10 ml in the measure. You can have this one usually used for measurement of large volumes. For small volumes, we use graduated pipettes. We use also semi-automatic pipettes like this one. Okay. So you know how to use it already from chemistry. For mixing and grinding, we have two types of mortars, and usually we do it using mortar and pestle. We have two types, the glass and the porcelain. Glass is usually used for colored material. Okay, so is used for mixing of small quantities of fine powders and for the mixing of substances such as dyes, which are absorbed by and stain composition or porcelain mortars. Okay, so stain compositions or dyes that can be absorbed by porcelain mortars, so they cannot be grinded or mixed in porcelain mortars. You have to use the glass mortar for them, and small amounts of fine powder, because usually the surface of porcelain mortar is little rough and can take most of the fine powder. If it is small amount, you cannot recover, you lose too much, so better use the glass. Okay, usually for adequate mixing, don't overfill, so you have always to use mortar that is larger than the amount of powder you are grinding, so that you will not have spills outside and loss of powder. The pestle should be rotated in both right and left directions to ensure thorough mixing. You don't just keep rotating in one direction. And then you should not press too much. Undue pressure should not be used. You don't press the pestle too much, otherwise it will cause impaction of the powder on the bottom of the mortar. We don't use to impact, we need to grind and mix only. Filters can be used also, like paper filter and membrane filters. The problem for paper filter is they come in different pore size, so you should use the pore size that is good for your powder. So your powder is fine, you need a smaller pore size. Your powder is coarse, then you need you can use a larger pore size. In both situations, you can use small pore size, but small pore size means slow filtration. Okay, so you better use large pore size for rapid filtration, unless the pore size is larger than the particle size. And usually membrane filters are much better when it comes to no fibrous materials will be introduced. They don't absorb too much of the active material. Okay. And then you have to select an expiry date for your extemporaneous preparation. You have to write on the label. How to choose the expiry date? It depends on the stability of your active ingredient in this formulation. So you should pay a due regard to the pharmaceutical data and evidence available. If you have literature, if you have any stability study for your drug in this kind of dosage form, then you can follow. Okay, and this is the last thing, the label. You can prepare a label. This one from Malaysian guidelines should include the same thing, also details about the hospital, the patient name, patient details, and the medicine details, name, strength, and how to use the instructions. And the expiry date should be there, most important, expiry date. Okay, so you have details of hospital or clinic, details of patient, administration instructions, drug's name with strength and expiry date. So the most important is, you may get confused. Now I'm requested to make a Lasix syrup. So how can I make? I can bring Lasix tablets and crush and dilute with syrup. Very simple as this. How about the expiry date? You have to look for any studies have been published about the stability of such formulation. Okay. To make your job easy, then some people, they made compilation of information and they prepared for you handbooks or guidelines you can follow. So you have two valuable guidelines. One is one guideline. You have two valuable references. One is guideline, extemporaneous formulation, issued by or written by, prepared by Pharmaceutical Services Division in the Ministry of Health, Malaysia. You can go to the Ministry of Health website, Pharmaceutical Services Division. You can find it in the guidelines list, or you can just type this name on Google. You can find it, download it, have a look. It has, of course, very short introduction, but then it has monographs or SOPs, you can call them, for different preparations that can be requested in the hospital, can be regularly prepared, and how to prepare them. What are the materials, medications you prepare from, any other materials should be added, how to prepare, and what is the expiry date. It's all there. Okay. If you want to take a book, then you can find also the handbook of extemporaneous preparation, a guide to pharmaceutical compounding. This is also a valuable source. You can look for it. and contains also information about extemporaneous preparation requirements and so on. And then they have also a list of preparations to be prepared, how and what is the expiry date as well. So maybe in the tutorial we will have some assignment, we'll give you some examples and then let you look for information in these references and prepare the SOPs. Okay, so by this slide we have almost done. We completed our lecture for today. So any questions? Any questions?